With more than 60 million women in the U.S. living with some form of heart disease, this topic has to be a real priority. And here's a sobering thought. It's the #1 killer of new moms and can affect you even if you are fit, eat well, and maintain a healthy weight. February is American Heart Month, and Dr. Sarah Speck, medical director at the Providence Swedish Heart and Vascular Institute, is here to share more. Definitely sobering, but we need to talk about it. Let's start with a basic but important question first. What is heart disease?
Thank you, Susie.
Yeah.
So basically, the heart's main job is to pump the blood around, right? And it does that through a series of valves that open and close, a muscle that pumps, and a series of electrical fibers that are embedded in the heart muscle itself. So you can have a problem with your valvular tissue. Valvular heart disease can be congenital, or you can have an infection, or it can be acquired because you've had a heart attack. You can have a disease of the muscle. It's called cardiomyopathy. That produces a weakened heart muscle that can lead to congestive heart failure. You can have a problem with the electrical system, and the electrical system can be benign, palpitations when you're getting in front of a program like this one, or or it can be more serious.
Say we're all having palpitations right now.
There you go. Or something like atrial fibrillation, which could lead to a stroke if left untreated. But far and away, the biggest problem that we have with heart disease in women is that which affects the arteries, and that's called atherosclerosis or coronary artery disease.
Okay.
And basically it's plaque forming inside the blood vessels that impede the blood flow. And since all of those elements that I just talked to you about have to have blood flow, if you have palpitations, you need to think about whether or not I have something wrong with my heart.
Okay. I know we're going to get to symptoms, especially the atypical symptoms that women sometimes experience, but what are some of the risk factors?
So coronary artery disease risk factors are divided into those you can do something about, so-called modifiable, and those that you can't. So aging, menopause.
Thanks for bringing us down.
Family history. If you're a woman who's had a heart attack in your family or a stroke in your family prior to the age of 65, as opposed to 55, then you are at risk for having heart disease and acquired. Those things you can't do anything about. But that's about 20%.
Okay.
But about 80% of things you can do. High blood pressure, whether or not you've had eclampsia or diabetes during pregnancy, whether or not you have pre-diabetes or eclampsia or diabetes now, whether or not you smoke, whether or not you have a diet that is high in fats, what your cholesterol is, what your blood pressure is, and whether or not you have a lot of stress and depression in your life, particularly acquired for women during various stages.
Depression too. We don't talk enough about that one. So symptoms of coronary artery disease or heart attack are different for women than they are for men. Some can be similar, but there's quite a few that are different.
They can be different, but again, the reason is because there's blockage to the heart muscle, and therefore the longer those symptoms go on, even if they're atypical, the more you have to think about, do I have heart disease as these manifestations. I've had women in the emergency room tell me if they could only burp, they'd feel better, and they were in the throes of having a heart attack.
So let's talk about then some of those atypical symptoms. I think we even have some we can put up on the screen as we talk. As you mentioned, right, the heart palpitations. What else?
If you have fainting, if you have a bad stomach ache, if you have not just pressure in your chest, but pressure in your elbow, your jaw, etc. Anything that is telling you that I'm not doing well, if you have unusual shortness of breath. And the other thing is we trust our instincts taking care of our children. If you don't feel right, you need to get
That's a good point. We rarely trust what's happening to us, but yes, we have that intuition, so to speak, but we don't always trust it for ourselves. Heart disease affects women in a few specific ways, and I wanted to talk about them. 1 in 3 women overall, but Black and non-white Hispanic women more than that.
Yes, unfortunately, Black individuals have a higher degree of heart disease both during pregnancy as well as during their lifetime. They have an increased risk of hypertension, they have an increased risk of arrhythmias, they have an increased risk of congestive heart failure.
And I mentioned this in the open, but incredibly sad, the maternal health death rate is connected to this.
That's right. 20% of women over the age of 20 have some degree of heart disease, and that of course includes pregnancy. But almost 50% of Black women over the age of 20 have some degree of heart disease.
Wow, and if menopause wasn't bad enough, heart disease, it runs a little bit higher then?
So menopause is a marker, right? Hair changes, eyes change, skin changes, and your blood vessels change, and they become more susceptible to this plaque-related disease. 1 in 9 women by the age of 45 have heart disease, and by the age of 65, it's 1 in 3.
Wow. Heart disease runs in many families, as you talked about, the things we can't always control, but what do we need to be thinking about and actions taken?
Well, again, the American Heart Association with their Go Red campaign has some very interesting and useful information. But essentially, what you want to be doing is trying to reduce the inflammation, reduce the formation of plaque. So know your numbers, know what your blood pressure is, know what your cholesterol is, and in particularly the LDL, the lousy cholesterol, versus the HDL, the healthy cholesterol. Don't smoke, get enough sleep. Address depression. Don't just say that it's nothing not to be regarded, because in my experience, depression is not only a risk factor, but nobody chooses broccoli. We don't take care of ourselves when we're under stress and when we're depressed.
And we're going to let you have the final word. Nobody chooses broccoli. Thank you, doctor. And to find out more about the Heart and Vascular Institute at Providence Swedish, go to the website you see on your screen, swedish.org/heart.
This portion of New Day Northwest is sponsored by Providence Swedish.